If you have knee pain, you may wonder which exercises are best to relieve it. Traditionally, rehab programs for knee pain heavily emphasized quadricep strengthening, the muscle on the front of your thigh. More recently, though, there's been an increased emphasis in glute strengthening, even to the extent that some people are saying that strengthening your quads may actually make your knee pain worse. So, which is best for knee pain? Quad strengthening or glute strengthening? Well, the answer isn't clearly black or white. In this video, I'll break down the benefits of both, plus give you my top 5 strengthening exercises for knee pain relief. So let's get started. Now, first of all, what are the benefits of quadricep strengthening exercises? Your quadriceps are 4 muscles, as the name implies, on the front of your thigh. Their function is to straighten your knee. Now, when you're walking, your quadriceps don't have to be all that active because your knee passively straightens as you swing through, and their function is really to keep the knee from buckling or collapsing. But that doesn't take a whole lot of force to do that. Where your quadriceps are more active is doing things like squatting or getting up from the floor or going up and down stairs. They help to straighten your knee as you're doing those activities. Now, your glutes, on the other hand, are made up of 3 muscles. Your gluteus maximus, the big one on the back of your hip that extends your hip, and then your gluteus medius and minimus, which help balance you from side to side so that you're stable as you're on one leg. Now, your gluteus medius and gluteus minimus are much more active when you're walking because they do have to balance you from side to side. Furthermore, you use your gluteus maximus to push off and propel you forwards when you're walking. And so if you do have knee pain when you're just walking, more often than not, it is a gluteal problem rather than a quadriceps weakness problem. Now, on the other hand, your glutes also help with squatting, going up and down stairs, and getting up from the floor. And in most functional activities where you have to bend your knee, you're also bending your hip. And so it's not a question of is quad strengthening good or is glute strengthening good, but rather how to use them in appropriate proportions with one another. So what are the top 5 strengthening exercises to help out if you have knee pain? Well, in some cases, there are times when you need to purely strengthen your quadriceps or purely strengthen your glutes. Examples might be right after surgery when you've lost some function in your quadriceps or when you're not able to bear weight on your legs. That's a good time to do isolated quad exercises. For example, doing quad sets where you just straighten your knee, or isolated glute exercises like bridges. Largely, though, that's not the way that we function in real life. We squat, go up and down stairs, get up from the floor, and walk. And those are the bulk of the activities that we do in everyday life, unless you're involved in some sport. So how do you strengthen your leg muscles to get better at those activities and be able to do them without knee pain? Well, largely the exercise should mimic the activity that you're trying to get better at. So first, let's start with a squat. You use this to squat down to pick things up off of the floor, get up and down from chairs, get off the toilet. And if you do have knee arthritis, many doctors may even tell you that it's bad to squat or that you should never squat. But you have to do those things in everyday life. So here's how to do a squat in a way that strengthens both your quads and your glutes in appropriate amounts and be able to do it without knee pain. Now, the deeper you go down into a squat, the more compression it does create on your kneecaps. So if you do have knee pain or you're not confident in your leg strength, start out with really shallow squats. Now, how you set up for your squat will set you up for success. So your starting position, you don't necessarily need your feet pointing straight ahead. Some people naturally toe out, some people naturally toe in, but for a squat, most people are going to be either pointing straight ahead or slightly toe out. So just go to a width and angle of rotation that feels comfortable for you. Now as you squat, you want to start the motion by Sitting back on your heels, slightly unlock and stack your trunk position. So you want to have your spine in a neutral position, not too rounded, but also not too arched. So unlock your knees a little bit, roll your pelvis underneath. Now you're going to think about starting the motion by sitting back. As you sit back, this uses your glutes. It's controlling hip flexion. So you're going down into hip flexion and using your glutes to control that motion. At the same time, you're using your quadriceps, which are knee extensors, to control knee flexion. So you're using both the quads and the glutes while doing this eccentrically, meaning they're working to shorten while in reality they're lengthening. And just go down to a depth that feels comfortable for you. The more forwards on your toes you go, the more of a quad strengthening exercise this becomes. So your trunk will stay relatively more upright, your knees will go more forwards over your toes, and this makes it more of a knee extension type of movement. There's always both quad and glute activation, but weight more on your toes and trunk, relatively more upright, and hips over top of your feet make it relatively more of a quadricep dominant exercise. Conversely, if you spread your feet a little wider, turn out a little wider, and sit back more towards your heels, this makes it more of a hip extension type of movement, which emphasizes your glutes more. And again, your quads are still active. Now, to see that from the front, there are a couple other nuances that you want to make sure you're controlling. Remember, your glutes control more of the side-to-side motion of your legs, so your quads are really just going to be involved in this knee straightening and bending motion. However, as you're going down, one of the major causes of knee pain is your knees knocking inwards too much and your feet flattening out too much. So dome the arches of your feet a little bit and kick on your glutes. So kind of turn your knees out to the side. Now, with the way that the neck and the shaft of the femur are oriented, as you go down, most often your knees are going to have to turn out just a little bit. And then as you come up, they're going to come a little bit closer. So squatting down, your knees go out a little bit. Coming back up, they come a little bit in. Not way in, but a little bit in. So think about dome your arches, get a nice solid base underneath your foot, turn the knees out slightly, sit back, weight on your heels, and then come back up. And that knee turning out emphasizes both the gluteus medius and gluteus minimus, as well as your gluteus maximus. So that's the squat. Now, once that gets easy, if you can do 10 or more repetitions down to 90 degrees or greater, then it's time to add weight. If you can't get down to 90 degrees, then just focus on increasing your depth. And the further down you go, the harder of an exercise it becomes. Now, once you can do that, you're ready to move on to the next exercise, which is the lunge. The lunge is used for getting up and down from the floor, which is another activity that we have to do quite often in everyday life. And it's particularly important if you do happen to have a fall to be able to get back up from the floor. Now, the lunge automatically increases the difficulty because instead of lifting your entire body weight with two legs, you're lifting it primarily with this front leg. And you still have your back leg in contact with the floor for balance, but it's probably about 90-10 or 80-20. Most of the force goes through the front leg. Now, the way that you do the lunge can also emphasize more quads or glutes. If you do a forward lunge like this and bring your knee out over your toe, the more knee over toe you go, the more quad dominant this becomes. So if you're going way out knee over toe, this becomes a very quad dominant lunge. If you do more of a reverse lunge, or if you're staggering and sitting back on this back heel more, this becomes more of a glute dominant lunge. And so again, the more backwards you keep your weight, the more hip extension force it is, the more forwards knee over toe you go, the more knee extension it is, and the more that it emphasizes your quadriceps. Now, the lunge does require you to control the side-to-side motion of your knee to a much greater extent than with a more symmetrical exercise like a squat. However, it doesn't require nearly as much side-to-side control as a fully one-legged exercise, because with a lunge, you still have both feet in contact with the floor. And so the next exercise is going to be a single leg balance exercise. This one really just involves your glutes and your foot muscles to some extent, but it doesn't really involve your quadriceps. This is the only exercise in this video that's just going to involve your glutes. But to balance on one leg, you want to try to be able to keep your pelvis level without your knee turning inwards and your foot flattening like that, or without the other side of your pelvis dropping down. It does help to do this in the front of the mirror, especially if you're getting started, and if you have to hold on to something with one hand for balance, that's perfectly okay. Work up to standing on one leg for 10 seconds or longer without holding on. Now, you don't necessarily need to be able to do that to move on to the next exercise, but the next two exercises are going to be fully on one leg, so it helps to have good balance in order to be the most successful with these. The next exercise is a forward step up. This one has your weight entirely on one leg, so you're using only the lead leg to push you up the stair. This uses both your quadriceps for knee extension as well as your glutes for hip extension. It also makes you balance side to side. Now, if you don't feel safe or steady doing this without holding on, again, hold on to the rail if you're using actual steps or a chair or other sturdy piece of furniture to keep you steady as you're doing this. Make sure that you're not allowing your knee to cave inwards. So think about gripping the step with your foot, turning your knee slightly outwards as you would with a squat, and then pushing up, driving that knee out, and keeping your pelvis level like you would with a single leg stance. To see this from the side, put your foot up on the stair, load your weight out over the foot, push the step down into the ground, and lift yourself up. Much like the squat and the lunge, you can also make this more quad dominant or glute dominant. If you keep your weight more on your toes, trunk relatively more upright, this is going to be a much more quadricep dominant step up. If you lean your trunk forwards, get your body weight out in front of your foot, and then drive your hips in like that, that's a much more glute dominant step up. Now, if you do have knee pain going upstairs, and particularly front of knee pain when you're going upstairs, it probably will be more comfortable for you to do more of a glute dominant walking upstairs, where you lean your trunk into the stairs and think about driving your hips forward rather than thinking about keeping your trunk straight and straightening your knee. An additional tip is that as you're walking upstairs, if you think about using momentum to push the stair down rather than pushing your body up and walking through the next stair and onto the next, that may also help you to go upstairs more comfortably without knee pain. And then the final exercise is just the opposite, stepping down from a stair. Stepping down from a stair, much like lowering down with a squat, is an eccentric exercise. It focuses on using your quads and glutes as you're lowering down. Now, if you're doing this on a stair, it can be a little bit dangerous, especially if you're not confident in your balance. So often it helps to practice the same motion on the floor, doing a single leg stance to start out, and then sliding your foot forwards as if you're reaching down for the next stair. If you do need to hold on to something, absolutely feel free to do that for balance. Try to keep your knee straight ahead. Don't let it turn inwards or outwards like that. Think about going down in a slow, controlled manner and then coming back up. Go down in a slow, controlled manner and come back up. Now, going down a stair is much more of a quad dominant exercise. You really can't use your glutes to a great extent because you're trying to bring your weight out forwards. However, you do actually use your calves to some extent, and particularly your deeper calf muscle called your soleus. Your soleus helps to lower you down eccentrically through the ankle while you're bending at your knee. So going down a stair, rather than using more glutes and quads, uses more quads and soleus to help control you in that down the knee motion. Now, if you're just doing a single leg squat, you can absolutely sit back like that, and that'll emphasize your glutes more. But if you do need your body weight going forwards as if stepping down a stair, it's more quads and soleus going down like that. So those were the 5 strengthening exercises to help if you have knee pain, and most of them use both a combination of quads and glutes. Now, if you'd like more tips to help relieve knee pain, check out our knee pain relief playlist right over there. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.